Good evening, everybody. Welcome to Dr.DWIBHASHI Acupuncture Education Series. So today's topic is on golfer's elbow. It is also called as medial epicondylitis. So we will dive into topic just now. Learning objectives: understand anatomy, causes, symptoms, diagnosis, and management. Definition: golfer's elbow is an overuse injury involving the common flexor tendon at the medial epicondyle. I have just shown the inside medial side of the elbow. Pain on the inside of the elbow may be related to conditions like golfer's elbow, medial epicondylitis. Tenderness is commonly felt just below the bony bump on the inside of the elbow. Anatomy: humerus, ulna, radius, epicondyle. So everything I have explained. Here is the humerus. Here is the lateral epicondyle. And this is the medial epicondyle. This is the capitulum. This is the olecranon fossa, and this is the trochlea, this is the radius, this is the ulna, this is the olecranon process. Trochlea knot. The medial epicondyle is the attachment site of the forearm flexor muscles commonly involved in conditions like golfer's elbow, medial epicondylitis. Muscles: flexor carpi radialis, flexor carpi ulnaris, pronator teres, palmar longus. So these are the bony landmarks. Already I have explained you, and these are the muscles, the pronator teres, flexor carpi radialis, palmar longus, flexor carpi ulnaris, flexor distans superficialis, and common flexor tendon origin from the forearm flexor muscles of the medial epicondyle. This is the medial epicondyle. So front view, you can see humerus, lateral epicondyle, medial epicondyle, radius, and this is usually seen in X-ray. So the common flexor tendon is the shared origin of multiple forearm flexor muscles. Wrist flexion, bending the wrist, finger flexion, forearm pronation. So the medial epicondyle is the bony prominence on the inside of the elbow where the common flexor tendon attaches. Overuses or repeated strain can lead to irritation and pain known as golfer's elbow or medial epicondylitis. Causes: repetitive gripping, lifting, manual work, sports. Risk factors include poor ergonomics, repetitive work, age 40 to 60 years of age. Symptoms: inner elbow pain, weak grip, tenderness, pain on lifting. How to examine? In examine palpation, resisted wrist flexion, grip assessment. So this is, I have showed you the grip strength demonstration. Resisted wrist flexion is in the another slide. So assessing forearm and hand flexion. This is the dynamometer. Sit or stand with your shoulder erected and elbow at 90 degrees. Forearm in neutral position. Squeeze the dynamometer handle as hard as possible for 3 to 5 seconds only. Repeat 2 to 3 times and record the best score. Compare strength between both the sides. Okay. What it helps assess: forearm muscle strength, hand function, recovery process, effective of treatment. This is a strong grip. Normal range varies by age and gender. And this is the weak grip, may indicate pain, weakness, or dysfunction. There is a separate chart for the measurement. So key one: reduced grip strength on the affected side is common in conditions like golfer's elbow, medial epicondylitis. Differential diagnosis: ulnar neuropathy, arthritis, cervical radiculopathy. Resisted wrist flexion test for golfer's elbow, medial epicondylitis. Patient sit with the shoulder adducted and elbow extended. So you can see the elbow extended. Forearm in supination. So this is the forearm in supination, palming face up. Patient flexes the wrist against the resistance applied by the examiner. So I am applying the resistance. Pain or tenderness on the inner side of the elbow is the positive side. This is the positive test. So positive pain or tenderness on the inner side of the elbow. Negative test means no pain or tenderness. Investigation: usually clinical imaging selected patients. Management: activity modification, rehabilitation, medicines when appropriate. Acupuncture may be considered for selected patients with a comprehensive treatment plan. Exercises include gentle stretching and progressive strengthening, prevention, warm-up, ergonomics techniques, regular breaks. Miss: not only golfers develop this condition. Patient advice: seek medical review if pain persists. Key takeaways, that is early diagnosis and rehabilitation are important. Differences, evidence-based musculoskeletal rehabilitation. Thank you. For appointments, please contact 8374 888 794. That's all for today. We will see you tomorrow.